behind the cloak. And if you stay in the mist, you gon' be soaked. So listen up, cause this hair of the dog, what's real, what ain't? Is this the fog or smog? Cause there's a difference when you breathe it in. So don't let the corporate media take you for a spin. This that morning show, they put you in the know. So I hope that you ready, cause all we do is go, go, go. Yeah, come get your info, you gon' be like, whoa. Hair of the dog, we bout that, ayy. We in the zone, we out here, yeah. Speeding the facts.
Good morning, everyone. Welcome to Hair of the Dog. I'm Andy Kennedy. It is, actually, I'm really hoping it's Wednesday. Yes, it's Wednesday. I'm not having a very good morning, but I'm not going to get into that. I'm just rather confused and kind of tired and, 2020. So welcome. We are, I guess, it's kind of odd for a Canadian to say, but we are pre-holiday. Everybody's getting ready to do nothing because they can't, which is going to be kind of an interesting dynamic for what people normally do on Thanksgiving, which, as I understand it, involves a big balloon parade, people getting charged for assault while shopping, and basically just annoying one another, watching football and eating tryptophan. So if that's your normal thing and you can't do that, maybe it's not a bad thing. Just reaching out, just trying to, cushion the blow of the COVID holiday that's coming up. And we'll get into that and on top of a few other things. But first of all, the most important thing is I'm going to introduce my lovely and talented co-host who, unlike me, is actually in a good mood and bubbly and smiley today. Miss Kerri Barber. Good morning, Kerri.
Good morning, Grumpy Andy. This is such a rare treat. People don't realize Andy is always in a good mood. Always in a good mood. So if you're catching the program today, bookmark this because this never happens. So we're getting Grumpy Andy today, and I'm here for it. Hopefully I don't piss him off too much by enjoying it. But yeah.
I'm just gonna get this out of the way right now. This goes for the entire hour. Fuck right off.
Say it again in your Canadian accent. Do it again.
Fuck right off, eh? Jesus Christ. What the fuck is the matter with you?
Oh, I love it. I love it. I'm going to go back after we're done today and make that my ringtone.
I think I'm in such a bad mood that the only thing would make me feel better is a Timmy's coffee sweetened with maple syrup in a big plate of poutine.
Ah, there you go.
served by a attractive beaver.
An attractive beaver. Aren't they all attractive, though? I mean, honestly.
Well, no, not really. Some of them are rather unattractive, and some are actually some of them. When you see them, they make me look jovial. Right.
Oh, well.
Beavers are not. There was a meme that came out. I think it was a couple of years ago. I think it was the most Canadian picture ever put out there, and it was a Tim Hortons coffee shop drive-through lane that was being blocked by a beaver.
He had to get his Timmy's on.
Yeah, and people were rolling their windows down, and yelling out the window, excuse me. I'm sorry, but you're going to have to move, eh?
Oh, that's brilliant. Oh, poor beaver. He was just waiting for service. So, see, now we got Andy laughing.
Well,
you.
It's really disappointing when you order a coffee and you can't get wood chips.
I'm sure we all need a break from it, but so I'm a little jelly this morning because Andy is all pretty and professional and I am still stuck in a closet.
Is that what you're calling your place now? The closet?
It's a closet. It's a large walk-in closet, but that's pretty much what it is. But so we had some important developments, and I want to get to a little bit of housekeeping before we get to the big topic this morning, which, as Andy alluded to, is the U.S. Thanksgiving holiday, and how to have a safe one. So a little bit of housekeeping. Number one, the news came out that Janet Yellen has been selected by the Biden campaign over Elizabeth Warren, and I am so here for that karma, because we know, hindsight 2020, we know what she was doing. So in 2016, she was, playing ball for the corporatists. So when she came out and ran for president, we knew what she was doing. And I remember getting into some arguments with, in particular, the Becky Brunch crowd, who had been Bernie supporters, particularly women, were all in for Warren and trying to argue that she was a progressive. And we were like, nah, and they just went full bore on, attacking the Bernie Sanders supporters who were still on progressive policy and, not necessarily personality, but on policy. So here we are. We now know, and I posted the reporting from Politico where she wanted it so bad. And she was telling everybody about it, making it known, pick me. But she didn't get picked. So in the dodgeball of DC politics, she's without a team. So once again, I'd like to put out a call and join the call from others. Who's going to run against Elizabeth Warren? Seriously, we need her to take a seat and go do something else. Maybe she can go volunteer for Indigenous peoples the way she hasn't for the last 40 years. So
maybe she should go back to 1024th of the reservation.
Maybe. So the other big tip, I woke up this morning to a viewer submitted, this is a hot tip, and I posted the link, how Biden actually stole the election. This is amazing. And somebody took the time and effort to put together a full website on this. So just real quick, make sure I got it right. Howbidenstoletheelection.com. So that link is in the chat, and you will see that if you come to our Facebook, our YouTube, our Twitter. Go ahead and, we wanted to put it out there. So thank you, Mike, for that hot tip this morning. I was up at 5 a.m. this morning and what this shit. So that is out there. But just real quick, getting back to Yellen. Okay, so Yellen right now on CNN and corporate media is being touted as the nod to progressives. The progressives will be very happy with her because she is a distinguished member of the Brookings Institute. For those who are not aware of the Brookings Institute, it's been around for, decades upon decades. I think 1967. I don't remember the exact date, but if you go out and look at their policy, they're more centrist, a little bit to the right centrist. And I just did a quick search this morning looking for MMT and nothing. There's nothing even alluding to it, nothing even talking about policy, not mentioning MMT. So this again goes back to the co-opting of the term progressive, right? How can you call yourself a progressive if you're not advocating policy that moves us forward, but moves us back? That's not progressive. So take that for what you will. And Andy, you have something coming out, I think Saturday, with more of a deep dive on this entire topic. Is that correct?
Yeah, and it's actually very interesting because from what people are hearing that Steve Mnuchin did with the CARES Act and how he's gotten rid of certain special provisions in the CARES Act that make it look like it's a bad thing, basically, without getting into the details. And this is what we're going to see on Saturday. Cornell law professor Robert Hockett did an interview with us at Macro and Cheese yesterday and did a deep dive into why that isn't necessarily a bad thing, right? Which is, surprising to the way that mainstream media talked about it in the brief 5 minutes that they talked about it. And in terms of what it means with Janet Yellen for her, the job that she's been asked to do. So what basically Bob's going to do is he's going to break it all down and show why this can actually be a good thing. And of course, now their interview was an hour and a half, so it's not like I can explain it in a few sentences. But it's going to be a very enlightening conversation, let's just say. And that's going to be released on Macro and Cheese at Real Progressives on Saturday morning at 8 a.m. Eastern. So if you're interested, you can check it out there. I can provide the links to it as well.
Yeah, we'll definitely post the links because there's one piece of the CARES Act that I did not know about, and we'll talk about it later. It's something that I am personally going to pursue. So I wanted to share this information because when I went out and looked across all the media, nobody was talking about this part of the CARES Act that may provide some benefit to real working families. So yeah, so we'll get into that one in just a little bit. So for those of you who are just joining us brand new, first, thank you for joining us. We're starting to see social media pick up they're retweeting and sharing our information. And honestly, I got to tell you that corporate media, including the channels that we distribute on, we're on 12 different channels with different aspects of those channels. We are banned from promoting our own network and our programming. So what was interesting is like during the election, of course, it makes sense to have a ban on political ads and promotions. But now after the election, they've kept it up. And the problem is independent media, if you are listed not as entertainment like Fox and CNN and all of these, but if you're credible as news and you delve into politics and policy, you are banned from promotion. We cannot promote. So what we rely on is people like you who are learning something, are being engaged and sharing our information and letting other people know. So thank you. We appreciate that immensely. And it's an interesting across the board tell for the suppression of free speech. So I'm not talking about, hate speech or anything like that. I'm talking about even in Biden's camp, he's got people that he's forwarding who, like the guy who was the editor of Time magazine back in the day, who is now on Biden's transition team, talking about how we need to have suppression of news and how fake news needs to be regulated. So they are actually going away from free speech and journalism. And we can see that from the Assange case, that they don't want anything more than controlled propaganda. And this is why, groups like Status Quo and what you're doing on Macro and Cheese and all of these different outlets are so important. And obviously we can't advertise, so we rely on viewers sharing our content, and we appreciate it.
Absolutely.
So yeah. So I just want to put that out there real quick. And along the lines of suppression, I thought this was interesting. So there was an interview on CNN with Jamal Bowman. Jamal, if you recall, was one of the true progressives elected to Congress. And he's very outspoken and he's very passionate. He's very in your face. Dude actually has a backbone. So what we saw is he was on CNN doing an interview. And when he was criticizing one of the members of Biden's transition team, Rahm Emanuel, he cut out. Now, it is possible that there was a technical issue. Those crop up from time to time. This one looked a little sketchy. So I did in the links post the tweet that came from, hold on, I'm sorry. Looks like Jessica Grace on Twitter posted this, and she has the video out there. So if you want to go and take a look at it, I don't know, look, see what you think. I feel like it's a little sketchy, and that is based on the production work that we do here. The fact that I have like zero internet and we're still able to stream, Andy still be able to pick it up in a foreign country and restream it out to the network. CNN, who has multi-millions more in resources and satellite technology, yeah, I question it a little bit, right? So there's that. And then the other piece on this that I wanted to talk about was the antitrust. Antitrust is really an important topic. So you've got Andy's Macaroni and Cheese talking about finance, where we were, how money actually works. Antitrust laws play a part into that. And we published an article, we had permission to repost this, for PhD economist Sherry Weiss, who we're still hoping to have on Friday. And I got to reach out to her because she is also dealing with her own personal emergency, and we may have to reschedule that just to be respectful. But she posted a series of articles. We published the first one, second piece will come out today, but it's a 5-minute read on where antitrust laws came from and why they came about. Think of when you were in elementary school and we talked about the robber barons and the Rockefellers and oil and all of these sort of things. There was a pragmatic approach that no, it's not good for the country. It's not good for the people. It's not good for our economy to have the monopolization of finite resources. And these people are exploiting their workers. It's probably not a good thing for the future of our country. So they put in regulations, and these were known as the antitrust laws. What we've seen, and Sherry goes through this wonderful brief analysis and shows you how we whittled away on some of those antitrust laws to get to where we are today. So when you see Foxconn having to put out nets so people don't jump to suicide, or Amazon people falling out in the aisleway doing their fulfillment, this is where antitrust laws would come to help them. And that is part of what created the free market. The free market itself is created by the regulations that the government puts in place. Creates kind of like that boxing ring. Can't have a ring, can't have a free market if you don't have some framework around it. And that's exactly where antitrust laws came in. So
in Canada, it's called the Occupational Health and Safety Act, and it's a federal act, and it is a guideline for every single worker in the country. Right? It gives a bare minimum of safety for every single person. And you're right as a worker to refuse unsafe work, right? And with the stipulations of how you proceed if you are, working in a dangerous job, like working off a ladder or a boom truck or whatever, or with hazardous materials or in a confined space, and it keeps people safe and it works.
Right. And I used to write a lot back in the day about management, teaching managers how to be good managers to help them increase productivity, employee engagement, that sort of thing. And one of the things that I talked about often was when you take care of your employees, they will take care of you, especially as a manager. When you have, annual RIFs coming around, you don't want to be the manager who doesn't have the numbers and data to prove it. Well, one of the ways to keep your costs low, keep your productivity high, and keep your people engaged and happy is take care of them. Treat them decently like human beings. And this goes into safety as well. So it's just basic management skills, basic monetary policy, basic accounting for a corporation that we seem to have gotten past, particularly here in this country. So,
well, it's not profitable, right?
It is, and that is the frustrating part. It is far more profitable than what we're doing now. The difference is it takes a little longer to realize that profit, and by a little longer, I mean a year as opposed to a quarter. And when we're going to quarterly reporting, it's really hard to see those numbers. And the average CEO now has a tenure of about 2.3 years. So they're in there to cut quick, get their stock options, sell out, and move on to the next. So
yeah, absolutely. But what I mean is that, and it's well known in the industry, especially in large corporations, that shareholders and stakeholders that it will invest in a corporation actually look at the corporation's record, at how poorly they treat their employees, as a gauge whether they're going to invest with that company or not. That's actually true. I've seen that in documents in corporations, in the corporation I worked in. Right.
Excellent point. Excellent point. So with all of that in mind, we're going to turn a little bit to the topic of corporations in the healthcare setting. So today we want to talk a little bit about the American holiday of Thanksgiving, which Andy eloquently described. It's kind of like Sweetest Day, where it went from the original intent to now this corporatized money-making thing, right? So we have, football and eat too much food and gluttony and gathering of family. And, we always have the joke about, your crazy uncle who's going to start some things. And so it has become this celebratory thing that doesn't really look a whole lot like the holiday used to. So how do you get through this holiday in a global pandemic? So there are some things that I think changing your mindset, right? So from the time I was a small child to today, there was this poem, this phrase that held true. It's one is not affected by the view that they see, but wait. I totally butchered this. One is not affected by events themselves, but by the view one takes of them, right? So that is changing the way you think about certain things in order to cope with a situation like this, where you have a major, massive holiday, and maybe you're not going to spend it the way that you anticipated. Maybe, I know a lot of people who this was their holiday, not Christmas, not Halloween, nothing. This was it. So how do you get through it? So with that corporatism in mind, in merging that with the pandemic, we're going to look at the American Hospital Association, and I posted some links there. So what I think is really interesting is they have taken the side of clinicians, right? I went out looking for what is their perspective, because this is primarily an organization for hospital administrators. Some of these people come up through the ranks after being a CNA, a nurse, or whatever, but few, very few. Most hospital administrators have more of a business administrative background. So they make decisions sometimes based on profitability, not necessarily on quality of care. They try to balance it, right? And here's what I was delighted to find, that this entire organization is primarily focused on protecting their workers. And that is the theme that I want to focus on today. The American Hospital Associations, clinics, hospitals, things like this, they are taking care of those who take care of others. And it's particularly important right now because we see so many who are testing positive for COVID or getting sick and showing symptoms and all of this. So there's one hospital group in a major metropolitan city, Chicago, that has over 400 clinicians out. And that's nurses, doctors, people who work with patients, people who have, the triage. All of these folks, over 400 of them are out. And that's huge. So where we see this spike now, not just in metropolitan areas, but in the suburbs and rural areas, small hospitals, small clinics that don't have the bandwidth, don't have the beds, don't have the care, they're being overrun. And from my personal experience, this happened just this week. So I'm staying in Airbnb, and there are 3, I'm in a small house behind two larger houses. And both of them were empty primarily for about a month, but we just had, I don't know how many of them, I think it's like 20 nurses come in from out of state. And they're here in New Mexico because there's a shortage of nurses now. The nurses that we had are sick, or they themselves are being redeployed into rural areas to help care for those COVID spikes. So this is, I hate to put a value on a person's life, right? But like, I look at my educational career, and to get where I'm at today, of course, there was experience and things like this, but it's about 4 to 6 years of education. To make a CNA, it's 4 years. To make a nurse, it's 6 to 8. To make a doctor is 8 to 12 or more, right? So when we talk about productivity and we talk about caring for those who care for us, the people that we need to be holding up are the nurses, the CNAs, the doctors, the people that support them. So if you're still of the mind that this is an infringement on your rights, an infringement on who you are, and you are antithetical to everything that we're trying to do, at the very least, maybe you could take some time to evaluate your thoughts on doctors and nurses. Think about your own doctor and nurses. Would you do something for them? And that's kind of what I want to talk about today. So, all right, Andy, first graphic. This to me was like, aha. It was the moment that was like, okay, we are actually starting to be e pluribus unum, and corporate media is actually getting on board, sort of. So this is the first one. Fox News. Fox News now has on their website a coronavirus information page. They never had that before. They were talking about it was a hoax and siding with Trump and hydrochloroquine and all that bullshit. Now they're actually talking about it. Now, of course, Fox is taking the side of the business end of it. So what they're really forwarding is these medical companies, the research companies who are coming out with new vaccines. So one of them, AstraZeneca, this made headlines all over Fox all day long, was AstraZeneca has pledged to do away with their profits if their vaccine is picked up, if people are buying their vaccine after it finishes clinical trials. So kudos to Astra. But Fox is actually taking the business reporting on the vaccine. And, oh, by the way, here's how you protect yourself. So kudos to Fox. I mean, reward good behavior when you see it. And I was, to me, this is a sign that they have completely changed and done a 180 from where they were, which is a good thing, because most of our anti-maskers tend to fall on the right. They were like Trumpers, the QAnon, the MAGAs, things like that. So when they start to tune into Fox, if they still watch Fox, they're going to start to see these kind of messaging. And we know from herd mentality and the way propaganda works, this is going to start to rub off on them. So a week ago, I saw a comment from a gentleman whose mother-in-law was very much a MAGA person, very much Fox News. And he was lamenting that he and his wife both had a positive COVID diagnosis and they were symptomatic. So they had to tell her that they were not going to be attending the Thanksgiving dinner that she planned. Same thing that she did every year, the entire family, make a big dinner, all of that sort of thing. They had to tell her that they wouldn't be coming. And he was really upset by her reaction. Her reaction a week ago was, you're ruining the holiday and you're doing this on purpose. Because she even then still thought it was a hoax. And he was lamenting that, first, she thinks we did this on purpose. Second, I thought that when, just like with marriage equality, when someone close to you reveals that they had it and they're having issues with it and there's a risk, that denial would go away. And he was like, no, she's angry at us for ruining her Thanksgiving holiday. So my hope is that, this particular mother-in-law and all mother-in-laws out there who were in denial are starting to see this now from Fox. And maybe we'll change our tune, because if nothing else, it really is going to take all of us. And we're seeing that over and over and over again. Another personal story, and I'm not going to name names because I think a lot of parents who have kids in college are going through this. One child, their significant other tested positive for COVID yesterday. And so they were wondering, should I go and get my child? Because I plan to. And so through the course of the conversation, what interested me is the significant other who had tested positive was planning themselves to go home and drive themselves home under the understanding that they were going to be driving alone. So my question was, well, this person that's going to be in the car driving alone, are they not planning to get gas? Are they not planning to stop and eat? Are they not planning to use a restroom? And there was quiet. And I was like, this is the problem. If I have COVID and I make the assumption that, well, I'm traveling safely because I'm going in a car by myself, and then, oh, I need to stop and get gas, and I go out and I use the gas pump and I pay for the gas, even if I'm doing it at the pump, I haven't sanitized, I haven't washed my hands, and the person who comes next after me, because it's a metal surface, we know that COVID can stay on surfaces for from 13 hours on to, I think, what did Dr. Dillon say? Like 4 days, right?
I think it was up to 7
7.
days or 9 days,
Yeah.
depending on the temperature and depending on the actual surface. I think metal surfaces was actually longer. And this virus, what makes it so insidious now, is that it's better in the cold than it is in the heat. Right?
Yeah, exactly. So even here in a desert state, it's cold. So it's cold enough for this virus to hang out on a gas pump. Who is thinking about sanitizing their hands, doing the gas pump, and then sanitizing their hands again? Certainly not somebody who's symptomatic and just trying to get home. So this is how it spreads, with us thinking about I, me, and mine, and not, okay, logical steps that I need to protect others. Right. So this particular person is taking the virus that they have from their state home to their family for a Thanksgiving holiday. And we see it over and over again. There was an article about a mother, Corey, in Missouri, who decided she felt so badly for her child missing homecoming that they planned a secret homecoming. And they did it at a steakhouse. And there were hundreds of kids there, no masks, all adults, no masks. And what came out of it was positive COVID cases. And they themselves, what makes it so egregious is not only were they doing this in secret, but they were hiding the guest list so that you could not do contact tracing. And contact tracing is important because what if I'm asymptomatic, but I am a carrier and I'm not self-quarantining? Now I'm spreading it to other people unknowingly. So this is part and parcel to why people need to stay home. And there was a statistic that came out, I guess CNN did a poll, and they said, I haven't looked at their extrapolation of data, but they said 61% of people who were surveyed said that they are changing their plans and staying home. So the sample size is important. The viewership responding to CNN's polls is important. Is that an accurate reflection of the entire country? 61% slight majority, but when you look at the rest of the country and people who aren't watching CNN, what does that look like? It's probably a lot lower. People are still going to go to family gatherings and things. Oh, well, it's outside, or, oh, well, we're taking precautions. We're going to see another spike in 2 weeks. I guarantee it. So, Andy, if you want to go to the next graphic, here's a state that has done woefully inadequate preparations. And a large part of it is because of the leadership in that state. This is a governor who is still saying masks are a personal choice. They are not making the mandate. And I do the comparison to New Mexico, the governor here the governor here, I mean, they're hardcore here in New Mexico because we had such a spike. And like I said, we had a shortage of nurses. So the whole focus here is taking care of those who take care of others. And in this other state, South Dakota, you can see this spike. And all of this comes down from the leadership and what they're saying to people. So South Dakota, they don't have the bandwidth to care for the people that they need to care for. So it's, we always look at the statistics of death, how many died. Well, how many can we prevent from dying who have a positive test? That's the number that we need to look at, right? And I keep seeing these people saying, well, people die every day. No, not needlessly. And why, when you drive down the road, are you not crossing the center lane? Why wouldn't you? People do it every day. Go for it, right? So this is the difference between the two. In New Mexico, we are already coming down. And part of it is you will be fined if you don't wear a mask. You will be fined as a business $5,000 a day if you're not taking the precautions that they've laid out. And these are pretty generous precautions, right? You have to limit how many people are in your facility. You have to have certain practices in place. Like one of them I love is restaurants no longer have menus. If you go into a restaurant here that's still open, very few people are seated. They're very far apart. All windows and doors are open because it's New Mexico and we can. And you don't get a menu. What you get is a card to scan with a QRC code, and it's on your phone. You're not allowed to put your phone on the table. You know, it's just, they're doing creative things, but because we were spiking, they've gone even further. Because it's expensive for the state, not just in terms of human life, but in monetary policy. And what are you going to do if you lose nurses and doctors? It's going to take you anywhere from 4 to 12 years to make new ones. And that's a reality, right? So, yeah.
And that's scary as hell. And, you know, we're going through that here at home right now with my wife, who's a scrub nurse in the local hospital, where she was starting to get cold symptoms on Tuesday. So she informed the charge nurse in the room that she was in. She was automatically sent to their boss, and she was automatically sent home because that's the protocol in Ontario hospitals. If you exhibit any symptoms, even if it's a reaction as far as allergies are concerned, right? You get sent home. You automatically have to make an appointment to get a COVID test, and you stay home until that COVID test comes back. So Deb's been off work for the last 2.5 days waiting for their COVID test to come back, right? But we're in cold and flu season now, right? So who knows anybody that doesn't come through, go through this season now without getting the sniffles 1 or 2 times, right? Even cold weather can bring about, cold-like symptoms, even if you don't have a cold. So then you have to go for your test and wait for it to come back. And we're seeing, especially in hospitals now, that it's not the workload, it's the number of people that have to wait to come back to work after getting these tests. And that's really been the issue all along here, right?
Yeah, absolutely. And from a layman's standpoint, there are places where it takes so long to get a test that it's really problematic to get your test and your test results. Excuse me, cat. So everybody's working from home.
That was a very Canadian response, by the way.
I try to be polite for my animals.
I'm sorry, but you're going to have to move.
Well, I'm trying to be polite because I know at any point they're thinking about killing us. So I'm trying to be very helpful
in their own cat little ways.
Yes, exactly. So the next graphic, I think, really gets to this point. And I purposely chose nonpartisan sources sources from the industry. This is from STAT, S-T-A-T. It is an industry publication, and they report on what's going on in the industry, new developments, how things are working in different areas of the country, learning opportunities, all of that. And this is a glaring headline. Now, this came out next week, or the week before, and we saw that, yeah, the spike did occur. So people are going to die. I don't know how much more plain they could make it. And the reason that people are going to die is not because they haven't, whoop, thank you, Kitty, told you, not because they haven't learned and been able to treat this virus successfully for higher recovery rates. It's because the staff isn't there. The resources aren't there. So you can't pull stuff out of thin air to help people. You've got to have the resources to support the entire program. And this was a week ago where STAT was reporting it's not there. It's just not there. And it's not just because there's a rural or remote hospital or a few beds or things like this. It's that the entire system has been taxed all across the board in every state. And that's a problem. So Andy, you want to go to the next graphic? I think this one pretty well enumerates what's going on with the resources. So here again is a list, and this is from the American Hospital Association in conjunction with the Journal of American Medicine and other reporting agencies, and this is real time. I pulled this yesterday. So while some states like New Mexico are starting to come down from the spike, we still have a massive shortage, hence my neighbors now, my nurses from out of state who've come in. So if you look at this list, this is a good portion of the entire United States, in particular the Midwest. And it doesn't matter whether it's a Democrat state or a Republican state, it's all across the board, because I think, you know, who is it? Sciencey Man. He said it best. He's like,
Bill Nye, the science guy.
Yeah, thank you. He said, you know, COVID doesn't care what color you are, what your ideology may be, your political persuasion. It does not care. All it cares is that you become a host so it can replicate. That's it. And we can see that from this list of states. These are states that have been hit so hard that they have a shortage of people to care for the sick, right? So it's not just, remember when this all started, we had a shortage of ventilators. Yeah, that's not the issue now. The issue now is we have a shortage of people to administer ventilators and medication and all of the things that are required to have a successful outcome. So now what, right? And we still have people who refuse to wear a mask. I had a friend who went to a doctor's office. It was a visit that you could not have through video or telephone. You had to physically be there. And when she walked in, she sat down, she had her mask on, everyone had a mask on. And then a gentleman walked in with no mask and sat down. And so she's looking around like, am I seeing this? Do I say something? And the staff there ushered her into another room. And they said, we're sorry, you know, we want you to be safe, but that's one of our patients who flatly refuses to wear a mask. Well, then the question becomes of why do you still have them as a patient? Why do you risk me and other people? Why are you risking anybody who walks into this room now because this one person refuses to follow along and support each other? They apparently don't care about you or others, but yet they want what they want right now. And so the staff, rather than pushing back, rather than thinking about their own families, rather than thinking about their other patients, didn't want to rock the boat. You got to fucking rock the boat. People are dying. And oh, by the way, all of those people who do recover now have a higher risk for chronic issues, life debilitating, life ending chronic issues. So that's the other part of this that we need to talk about. And, you know, needless to say, thousands upon thousands of dollars in medical bills because we don't believe in taking care of each other from a profit standpoint either. So yeah, all of these states now are in trouble. So one of the last ones, and I really think that this kind of encapsulates the message. So this is the blog post by Susan Stacy. She's a hospital administrator. She was one of the hospital administrators who came up as a clinician, as a nurse. So she's got 20, 30 years or more experience in direct patient care. And they have blog posts out on their site. This is, again, the American Hospital Association. And most of the blog posts are really, really very nice. There are a couple there that are in support of expanding ACA. But aside from that, her post, I think, and I put a link to it so you can read the whole thing. I think it was very telling about where her focus was. And what struck me when I was reading it was she started from the place of we instead of me, right? So she retells that early on in the pandemic, it was the experience and knowledge of the team member, not their title, that mattered. So she talks about how nurses who had preeminent experience in pathology and virology were explaining things to the CEO, hospital administrators, and major surgeons. So it was this whole collaborative effort that they were using, and the hierarchy and the titles and everything else just went away. And she says that that is how they were successful in Washington. If you recall, Washington State was where we had our first few cases come in, right? That was where it first started to bubble up, and then they had the first major outbreak in Washington State. So she's talking about the very first few on the front line. And then as you go through her post, I pulled out the 3 other topics that she talks about that I think she's right on, right? So you don't have to buy my opinion. You don't have to buy Andy's. Here's a hospital administrator who was on the very front line at the very first issue, saying that trust the experts, but not everyone who speaks is an expert. That means I'm not an expert. Fox News is not an expert. Some doctor that they trot out to say blah, 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 not an expert. You got to look at the people who are working on this. And oh, by the way, that's the WHO. We are in constant collaboration with our professionals, our virologists, working with the global team. So I know that the WHO themselves have been politicized by others. WHO is a really good source, especially in this time where the CDC has been suppressed. Their information and their guidelines have been suppressed. Go to the WHO. That's where these people are going, right? Second point she makes is we are at our best when we are giving back to others. And this I thought was critical, especially for all of us during a holiday, because it's so easy to get depressed during the holidays on a good day. Now we're during a pandemic. And it is my personal belief, and I keep seeing the evidence for this over and over and over, that when you start falling into that dark place, that is your first sign to do something for others. So what I'm asking you to do is, rather than think about, well, I can't, I don't have, I would like to, there but for, and being depressed about not being able to see family and things like that, remind yourself that you are giving back to your family. So we talked about it on Monday a little bit, and last week, all of these phrases going out about if you have a stay-at-home Thanksgiving, maybe you have a chance of having a happy Christmas with those people still around. So give back to your own family, your own friends, and stay home tomorrow. And then the last one, of course, taking care of the people who take care of the people is critical. And Andy, I think we are so fortunate to have your real experience, everything that you went through with Nurse Deb and having to prepare a trailer in your own driveway to make sure that the work that she was doing on behalf of your community, helping save lives, save her coworkers, she wasn't bringing that home to your own family. That to me was huge. I couldn't imagine my husband living in the driveway and I can't see him, I can't talk to him. And I remember you used to meet for a socially distanced conversation with your own wife, right?
On our back deck in the open air. Yeah.
Yeah. So if Andy can make that sacrifice, if his wife is making the sacrifice of risking her own life, why can't we stay home and just do a virtual? I mean, you can FaceTime. Even Facebook now allows you to create a room for your own family, so you can all get together from all over the country, all over the world, and have that conversation. Be totally embarrassed by your aunt, get pissed off by your uncle saying something crazy, and you can do it now through the technology that we share. Why wouldn't you? Make your own damn turkey. For those of you who just show up with a bag of chips and you know who you are, everyone else
Rolls,
is
dinner rolls.
right. Everyone else has spent days preparing, peeling 10 pounds of mashed potatoes, because if you show up with the box shit, you're wrong. But all these people have been preparing for days, blood, sweat, and tears. Now, make your own damn. And this is one of those where you can go get your own Cornish game hen or have it delivered or whatever. Just this is something simple, so simple, that we can do for each other, for our country, for our GDP, whatever you want to look, whatever piece is going to get you to think about someone else first. That's what you hold on to.
And I think that it's another part of this is that it's not really new anymore, right? When we shut down in March earlier this year, I think the fear factor of people not knowing what to expect was a huge part of, people being stuck in their homes and not knowing how it was going to play out. I'm sure people thought zombie apocalypse, or are there going to be deaths in my direct family? Plus also the part of, are we going to have enough food? Is there going to be enough masks or ventilators or what have you? That was a huge part of the trepidation that people were feeling back earlier in the spring. So I think that a lot of those questions in our own minds have been answered now. And we know what we have to do because we've done it already. We've, for the most part, well, Canada pretty much flattened the curve. I would say that the US had much more of a hump in their flattening, but they did slow down the cases to a point where, a lot of that fear was taken away. And so you know how to do it. You just have to choose to do it. And that's really the key, right?
Mm-hmm.
We have a little bit of pain now where we're not getting together. We're not going to be, this is 2020, right? This is the year that shouldn't have been. This is the year that everybody absolutely despises. And that's fine. Well, if you want another one in 2021, then you keep doing what you're doing. If not, do your time now. Get this under control so we can reasonably go back to normal in the spring when we've truly flattened the curve. And I think that's huge.
Absolutely, absolutely. And there's one more thing that I wanted to pass along to people that I did not know. This came out in the CARES Act, and nobody's talking about it. I did a search in earnest for quite a while. It was a couple hours, looking for any other news outlet that covered this provision of the CARES Act. I couldn't find it. And this actually came from my own financial advisor, because this is the space he works in retirement accounts, right? So I posted the link here. It's on irs.gov newsroom/coronavirus related relief for retirements. What this is a provision in the CARES Act. So it's got positives and negatives. And first off, I'm not an accountant. I'm not a tax advisor. If you're going to pursue this and look into it, I strongly suggest you talk to your own financial advisor to see if this is something that will work for you. But here's what they did. It used to be you had to have a qualified plan, like a 401k, that allowed you to take a loan. Through the CARES Act, it doesn't matter if it's a Roth, an IRA, a 401k, or other retirement vehicle. If you have been negatively affected by coronavirus, if you've lost a job, if you've lost income, homelessness, lost your shelter, all of these sorts of things directly related to the pandemic, you now have the ability to take up to $100,000 out of your own savings. Here's the catch. When you take out that money, you're still going to get that 10% penalty right off the top. And then that money is going to be added into your income for the tax year, unless you have 3 years to spread that over your income. So if you take that $100,000, you're 10% off the top, that leaves you with 90,000 hypothetically, then you add 30,000 per year for your income tax hit. You have the option then to pay that back over 3 years. Now, if you have money right now, maybe you can pay that back, but I almost see it like the rent moratorium, in that if you didn't have money to pay your rent now, and now you've got this balloon payment coming up in February, you're going to be in big trouble. Same thing with your 401k. So I just wanted to post that link in there. It is an option, especially for small business owners, for people who have been, if you're on the brink of losing everything and you don't want to go for a bankruptcy, this might be an option for you. So again, it's going to be up to your tax advisor, your financial advisor. But this program is only available till December 30th. That's it. We're at the end of November and we just found out about it. So I wanted to put that out there, that when it came to the CARES Act, we put the focus in places that didn't necessarily help Main Street. And this was one of those provisions that I don't think got publicity anywhere. So I wanted to put that out there. If somebody is struggling, maybe this is an option. So yeah, that was all I had, Andy.
Well, that was quite a bit. You know,
it was an hour's worth easily.
I just wanted to quickly say something. And we see a lot of people that are justifying, not wearing masks and not social distancing and all this stuff. And I know we've already talked about this, but there's a lot of stuff that we still don't know about coronavirus, including the long-term effects, right? The fact that it is constantly mutating like the flu does, because it changes a little bit every time it goes to a different host, right? Which pretty much is the reason why you can't get herd immunity this way, because there's so many different strains of it now, like influenza, right? We can't get rid of influenza because it's constantly changing. It's not like the measles or the mumps. It's a totally different way, and its structure allows it to mutate so quickly. So herd immunity will not work with COVID-19, right? We don't know what the long-term effects of COVID-19 are going to be, because the first cases have only started coming out in earnest only 8 months ago, right? So people that were infected, that had coronavirus, don't even know to the extent of how that's going to affect their lives yet, right? To say that, well, I didn't die from it isn't enough to say, well, I don't have to do this because I'm not going to die. Well, if you watched 60 Minutes on Sunday, you saw that there is a huge amount of people that got mild symptoms of COVID-19, and they're dealing with the repercussions of it now. Their bodies are still trying to fight it, and medical science doesn't know why. There are just way too many things that we don't know about coronavirus that we can say, oh, well, it's fine because I'm not going to die. We have to think about it. As progressives, we always say, were you willing to fight for someone you don't know? Well, those people that you don't know may be affected by this disease for the rest of their lives. Is it worth it for you to not be inconvenienced because of wearing a mask? And the one other thing quickly that I'll say is that there's a lot of people that say that coronavirus is a way for the government to control you with fear. And if you are only concerned with coronavirus, you're not concerned with homelessness, and you're not concerned with poverty and people losing their homes and their jobs and their health care. Well, that's not true, because we can control coronavirus, but we have to stand up to the government to control those things as well. That's the important part to remember. Coronavirus can be controlled at your level. The government has to step up and take care of the rest. And you have to demand that, right? If Joe Biden wants to explain to people why he's different than Trump, he has to start making people whole during this pandemic. That's not on you, that's on them. Okay, that was a little bit longer than I thought, and it actually turned out to be a little angry, so I'll apologize.
No, that was lovely, and that is totally clip worthy. So thank you, Andy. You said it very well, and I have nothing to add. So for everyone else, have a good quarantine, stay your ass home Thanksgiving.
That's right.
We may be back on Friday, or we may be taking it off, and I'm gonna check with Miss Sherry in just a little bit and see how that's going to play out. If not, we will definitely be back on Monday. So
yes, we will, and we'll be happy to do it.
That was creepy. Thank you, Andy.
Thanks, Kerri. You have a good holiday, and we'll either see you Friday or Monday. Take care.
We bout that, ayy. We in the zone, we out here, yeah. Spitting the facts, how it's supposed to be. Hair of the dog, we keep it G. Whoa.